name's Shona, I'm from Angus Health and Social Care Partnership, and I'm here to tell you a little bit about the Florence trial that we've been running across Tayside, which has been funded by Scottish Government's Technology Enabled Care Fund. Florence is a text messaging system that's been developed by an organisation called Simple UK, and is especially useful in long-term conditions, although we have used it with a variety of other things that you'll hear a wee bit about as we go on. Flo works very interactively. She could do it, and I'll call her Flo instead of Florence, and I'll probably say she instead of the system. But Florence will send messages, so she can either take readings or she can send supportive messages depending on what the clinician wants her to do. And this will be based on a set of instructions called a protocol that will be developed between myself and the clinician. So, for example, Flo can be taking blood pressure readings. And might, if the blood pressure readings are a wee bit high, we'll maybe say to the patient, actually that's a wee bit high, take a receipt for 30 minutes, take another reading and send it in. The other thing she can do is just send out supportive messages or motivational messages. So in the case of weight management, she might be sending out messages about healthy eating. So the clinician will either at appointments have extra information for that patient without actually having to see them, or have been able to support them between appointments. So, as I say, she's used primarily to help with long-term conditions and give the clinician that wee bit extra information between appointments. Sorry, at appointments, or help the patient between appointments without actually having to attend appointments. So this is kind of a timeline. We started in October 2016, got the licence then with a bundle of 37,500 texts. Our first services to come on board were weight management, smoking cessation, oral nutrition support service came on board, the heart failure service, and a GP and EDSO. So by the end of year one, we had 64 patients recruited. And we renewed our licence at that point with another text bundle. We then got a pain management programme on board to run that alongside the programme out of 9 Wales. And since we prepared this slide, we actually have the OT services out of Cornhill and Perth, using Flow alongside the breathlessness programme, and the pre-assessment clinic at Stracathro are looking to use Flow as well, and we'll hear a wee bit more about that from one of the team. We've also interest from the respiratory team at 9 Wales and the renal team who are looking at something very specific with their clients. And we've had some more GP practices come on board. So the initial funding does come to an end in September 2018, but we're fairly confident. It's an inexpensive system, so we're fairly confident that will continue on. So the previous slide did show that we had 207 patients signed up by February. So just to give you a wee breakdown of that number, this is kind of the recruitment figures for the start of the project to date. Yeah, so you can see the weight management figures are quite high, and that's because one of our clinicians really took to Flow and just ran with it immediately. She just loved it, ran with it, and other colleagues are now following suit. But I'd also like to mention the oral nutritional support team, because although their figures aren't high, what they've been doing is they've been doing a lot of work around laying the ground for Flow and for other telehealth initiatives. So there's been a lot of staff awareness going on, a lot of staff training, building the protocols and sort of just making sure everything's in place for this, a new way of doing things. So the lead for that is very much into telehealth, and we'll be here speaking later on, and this will all fit to modern outpatient programme. So we've been doing quite a bit of evaluation as well at this point, and we know that people are really appreciating the support that they're getting from Flow. And I'd like now to hear from one of our service users on the weight management programme.
We, as a village, have no health facilities. The majority of people have to go to either Angus, Perth or Scone to see a GP.
And tell me about the distances between here and those towns.
From here it's about 7 miles to Angus. Again, it's about 7 miles to central Perth, and we're probably 3 to 4 miles from Scone. I need to see the dietitian because I have some health issues, and when I spoke to my GP, he said these health issues would be best treated if I lost a significant amount of weight to enable them to be treated. Florence is a text service. Lisa asked us if we'd like to use it when we first started at the weight management programme, and she texts you once a week to remind you that you're going to weigh yourself the following morning. She texts you in the morning, she asks you to give her your weight that day, and you can do it in kilos or stones and pounds if you wish. And you text your weight into her, and then if you've not lost anything, she'll give you little reminders of what you could be doing. You know, she'll try and jolt you a little bit. If you have lost weight, she congratulates you. So it's just like a digital friend, if you like, that you're willing to share your weight with. Because as an overweight person, I probably wouldn't tell anybody what my weight was. I think the thing with Florence is when you're on a diet, they suggest you only weigh yourself once a week. You can become obsessive about it, especially when you see your weight going down. You could start to weigh yourself every day. But at least when you have to tell Florence your weight, you know you're doing it once a week on the same day at approximately the same time. So you're not getting that obsessive, oh, I'm tracking what I weigh, I'm tracking what I weigh, because that can get quite downheartening if you've put maybe 300 grams on or half a kilo on. You then think, oh, what was the point? But she just helps to maintain you on the track of doing it once a week. She just advises, she usually says keep a lifestyle diary, that'll help you get back into your lifestyle, get back onto good tips. It doesn't tell you off, it doesn't say, oh, you've put weight on, what are you doing? It just is it's a gentle reminder that you've put a wee bit of weight on, but if you just go back to what you were doing before, it's going to come off. She's a text, that's all Florence says. She's not a human being, but she has a support mechanism. She's that friend that you'll tell your weight to, because you, as an overweight person, I don't even tell my nearest and dearest what I weigh, it's none of their business. And I probably wouldn't have looked at the scales anyway if I wasn't doing this. So she forces me to see what weight I am, and I tell her, and I don't mind telling her. I think if you can use it as a tool, which is what it is, use it as a way to acknowledge what you're doing and to congratulate yourself as well when you see what you're achieving. It is a helpful tool. Yeah, I can't see why people wouldn't use it.
The next video is, I mentioned pre-assessment earlier on, and Fiona, one of our senior staff nurses, our senior charge nurses, is going to talk a little bit about how they're going to use flow in pre-assessment.
The surgical unit at Stracathro within NHS Tayside is an elective surgery unit where we perform day case and short stay surgery under various specialities, which are orthopaedics, general surgery, urology and plastic surgery. We take patients from NHS Tayside, but also from NHS Grampian and from NHS Fife as well. Certain procedures that we perform here require patients to have cross-match blood available. So the bigger operations like hip replacements, knee replacements, laparoscopic surgery, etc. So when the patients are pre-assessed, they have a first sample of blood taken for group and screen. But before they come in, they have to have a second sample taken, a cross-match sample. If the patient requires a transfusion while they're here, we can access blood in a specialised blood storage facility called the HemoSafe, which has an IT link to blood transfusion at 9 Wells. And we can access this blood if required. But to access this, it's imperative that the patient has the second sample taken before they come in. The anaesthetist, who is the lead anaesthetist for pre-assessment, had heard about Florence at a meeting that she was at and thought it might be good for us to use at Stracathro, given that although patients are informed that they will need a second sample taken, many of them forget about this, and we each week have to phone quite a few patients. It varies between about 4 and 10 to remind them to have the second sample taken. We're hoping that Florence will save us a significant amount of time. At the moment we identify patients that require transfusion support and check on a system called Blood Track Inquiry to see if the patient has had their sample taken and if blood's available. If not, we then phone the patient. Quite often we phone and there's no one in, so we have to try at various times of the day. And then when we do phone, we often find that the patient has several other questions not relating to the blood sample that they want to ask about fasting times and the time that they have to come in, etc. Although this information is all sent out to them. So what can, starts as a short phone call can end up being 10-15 minutes by the time the patient has asked several questions. So we're hoping that by sending the text that will cut down on that time, because the process of actually registering the patient on the Florence system takes a couple of minutes. It's a very short process. We had to liaise with the pre-assessment departments within NHS Tayside because they see the patient first and they have to gain the patient's consent for Florence to contact them. But they're been very helpful with that as well. At the moment, that's all we'll be using Florence for. This will be a test to see if it is effective. I believe that pre-assessment would like to use it for other prompts. Sometimes patients have to have stop certain medications before they come in for surgery. And I think that's maybe the next step. If this is seen to work for us, then that might be the next step to try that.
But we'll just go back to the slide, and there's a wee quote on there from another patient who's been using Flow, and this is a patient living with cystic fibrosis, a young person, young boy, or young man I should say, and Adam met Flow through his dietitian Alison. He entered the adult specialist dietetic service when he was just coming up to 18, and as I say, Alison's dietitian introduced him to Flow, and Adam had a gastrostomy, I hope I've pronounced that correctly, feeding tube, because he had to keep his nutritional intake up, and he really wanted rid of this, but he had to get his oral uptake up before he could do that. So with the help of Flo and the kind of supportive messages and the prompts that she was giving him, he managed to do this after about 6 to 8 months. He got rid of his tube and he said that was something he desperately wanted. Flo was a great help. So that was a good success story for us. We were really, really happy with that. So this is our flow thermometer, and this just kind of shows that we're on track to reach our target, which was 350 patients by September 2018. We reached 64 in year 1, 143 in year 2, which gave us 207 by just the end of February there, that should say February 2018. So we've 143 left to go before we reach target. And we're very confident that we'll do that, we'll probably exceed it. What has happened, however, is that we do have a lot of texts left still. The blue area is the texts that we have left. So we've quite a lot of texts left, although we're going to hit a target, and we are on track to meet our qualitative and quantitative outcomes. But this means that we've been using our texts very efficiently, and the protocols are obviously not using up a lot of texts. What it also means is we'll have space to do more trials. So if anybody's interested in doing a little pilot of Flow, as I say, we're fairly confident we can get the funding to take us past September anyway, but if not, that still leaves time for a little pilot, which helps us build a business case for the funding to be continued. So if anyone's interested in running anything with Flow, just let me know and get in touch.